Sleeping in the wrong position with scoliosis is like adding fuel to the fire. It could be the reason you're waking up with more pain than you went to bed with. Hey, I'm Dr. Chris Gubbels, leading expert in the non-surgical treatment of scoliosis. And in this video, I'm gonna talk about the best sleeping positions if you have scoliosis. Now, before we get started, I get asked about sleeping and mattresses and things like that all the time by patients. And big picture, I honestly don't really care what position you sleep in. You see, sleep is so important for our overall health. What I generally tell patients, the most important thing is, I want you to sleep in whatever position allows you to get good quality sleep. Because lack of sleep or losing sleep can wreak habits on your overall health. Plus, it makes it hard for your body to build and recover. That's when your body actually rebuilds and repairs itself, is why you're sleeping. So I don't want you to get so hung up on laying in a certain position that it makes it difficult for you to sleep. Whatever you need to do to get good quality sound sleep, ultimately that's the position you should sleep in. But beyond that, if you can sleep in different positions and you can still get good sleep, there are some positions that may be better for you than others if you have scoliosis. Now, another question I get asked all the time is, what's the best mattress for my spine or for my scoliosis? This is really different for every individual patient. It's someone's personal preference. I think, again, whatever mattress allows you to get good quality sleep is the mattress that you should use. But other than that, I think having a firm mattress or a mattress that's more firm is better than a mattress that is soft or sags. I also generally avoid those pillow top mattress tops because they tend to cause your body to sink and doesn't allow the support, because you want your spine to be in a nice neutral position when you're sleeping. So overall, if everything else is the same and you can tolerate different mattresses, number one, whatever mattress allows you to get good quality sleep. And then two, I generally think a firmer mattress is better than a softer or springier mattress. Now, if you're watching this video and you have scoliosis and you haven't already downloaded our free ebook on treating scoliosis, be sure to click on the link below in the description to get your free copy. Now let's dive into the best sleeping positions for people with scoliosis. The least recommended position for sleeping for someone with scoliosis is to lay on your stomach. There's a couple of reasons why this is the least recommended position. First of all, people with scoliosis, specifically a thoracic scoliosis, typically have a decrease or a loss of the normal thoracic curve in the thoracic spine. Laying on the stomach or face down can cause an additional or more decrease in the curve in the thoracic spine, potentially irritating the scoliosis. Also, when you're laying on your stomach, your head will be turned to one side throughout the night instead of being in a neutral position. And for some patients with scoliosis in the lumbar spine, lying on your stomach can put additional stress on the lower spine, causing an increase in back pain. Now, we have two preferred methods of sleeping for people with scoliosis. One of those is lying on the side. Now, this is a pretty firm table, but we know most people are gonna have a mattress that has more give or more cushion in it. I frequently get asked, what side of my spine should I lay on? And that depends where your curve is. If you have a big curve on the thoracic spine on the right, we recommend laying on your left side. So we recommend laying on the opposite side of your major curve or scoliosis. Because if you lay with your curve size down and the bed actually dents or sinks in when you put pressure, that can cause the curve to increase while you're laying on your side. But if you're laying in the opposite position with the curve up, it can actually open up the scoliosis. If you have more than one curve, we recommend deciding which curve is more severe or more painful and laying with that side up. If you have a curve in your lumbar spine also, you want to lay with that side up if that is the curve that's causing the most problems. Because laying with the lumbar curve down can also cause an increase in the scoliosis. A couple things you want to do to help increase spine stability and take pressure off the spine. One thing is you can actually put a pillow between your legs to take additional stress off your hips. Also, you want to make sure that your pillow is the right height to allow your cervical spine or neck to lay in a neutral position. You don't want a pillow that's too high that can push your head up, or one that's too low that can cause your head to tilt in the downward position. Overall, you want your spine to be in a nice, straight, neutral position while lying on the side. And probably our most recommended sleeping position for people with scoliosis is to lie on your back. This tends to allow for the least amount of stress on the spine overall, and it's not really putting your spine in any abnormal or bad position if you have more than one curve. To decrease stress on the lower spine, you can put a pillow under your knees, causing your knees to bend slightly. This will also decrease the amount of flattening you get in your lower spine when lying on your back. One important thing to make sure that your cervical spine or neck and your mid-back are in a neutral position, you want to have a pillow that allows for the normal curve in your cervical spine to be maintained. This is a specific orthotic pillow that allows for the curve of the neck and allows for the head to dip backwards, keeping a neutral cervical spine and allowing for a nice neutral and supported thoracic spine. So overall, lying on your back is the best recommended position for people with scoliosis. Now, if you have scoliosis and you're wondering what the best treatment options you have are, or how severe your curve is, or if your curve is likely to get worse, click on the link below and request a free discovery call. That'll give you a chance to talk to me for 15 minutes about your scoliosis, and send in your x-rays so I can review your x-rays with you. I can tell you exactly how severe your curve is. I can tell you the likelihood of your curve progressing, and most importantly, what treatment options you may be a candidate for. So click on the link below, request a free discovery call so we can get on the phone and talk one-on-one on what the best thing is for you and your specific scoliosis. Now, if you're watching this and you want to know the best non-surgical treatment options for scoliosis, click on our next video where I go over the specifics on the best scoliosis treatments.